afternoon, everyone. Before I start my talk, as customary for me, I'd just like to acknowledge country, the Gadigal people of the Eora Nation, and honour elders past and present. I'm just going to talk a little bit about my journey out at Inala. Inala is a suburb probably about 20 minutes from Brisbane CBD, going southwest. And I started back at Inala in 1994 in a community health centre, and Inala Community Health Centre. And it had university general practice, so it taught medical students, and it had all the therapies in there. But the biggest thing that stood out when I started to talk to people was only 12 Aboriginal people accessed the centre at the general practice unit. And that centre has a whole range of services, you know, from HAC, from child health and oral health, mental health, ATODs, breast and screening. So I've been in health now for probably 30 years. I was a late starter, and my biggest passion is trying to improve Aboriginal and Torres Strait Islander access to services. So I saw clearly that there was a problem of access to primary health care. So what I did is put in interventions, work with community, and now from that 12 today, we have over 10,000 Aboriginal patients on our books, with about 6,000 regular patients. So we've improved access to primary care dramatically. And I only just started there by myself, now I have over 60 staff. And we also do research, and we have a research director. And we've probably at the moment got about 30 research projects going with NHMRC grants, project grants and so forth. So in 2006-2011, the Commonwealth had a Healthy for Life program. And in this program it was very much geared to continuous quality improvement. All that money has gone into base funding now, but we still got to report on data. And it's because of that data I was able to actually access money. At that time, Anna Bligh was in government, and because we were showing great outcomes out of Inala, I was able to secure $7 million to build a new primary health care centre over the road from the existing Inala Health Centre, and with $2 million recurrent funding to actually employ more staff. So we certainly had the runs on the board about improving access to primary care. But when I started to do continuous quality improvement, I noticed that our patients weren't turning up to outpatients. And that was a concern to me. So with this Centre of Excellence, there's a vision of mine to have the centre linked to universities for teaching, research, linked to colleges. We have registrars there, we have GP registrars, psychiatry registrars, endocrine registrars, paediatric registrars. And also I wanted to actually do outreach to services where access is poor. And I did work out at Cunnamulla for about 60 years on the NSOAP Indigenous Chronic Disease program, but funding ceased. So one of my big things now was to integrate specialist care. So I had the primary care done, but I wanted to integrate specialist care because I could see all the problems. So in 2013, we actually opened our new building, and it's really funny. Like the Labor government gave me $7 million. LNP opened it, and then Lawrence Springborg was the minister, and I soon found out that he was evidence-based. So I got him to open it, and then he announced another $10.5 million to actually do an extension, which has just been built now. So you can see there. So nice. We work with community, so a lot of the artwork is from community, and that's the first, or stage one, where we integrate specialist care and primary care. And we have cardiology, and ophthalmology is one of our big ones that we first started with. So getting back to doing continuous quality improvement, this we did in the mid-2000s, and this is where we saw that screening for our diabetic patients was very, very low. And when we looked into it, they weren't turning up to outpatients either to get important laser for diabetic retinopathy. So just by having an annual diabetic check in our, with a retinal photo, we've actually linked that to the specialist care. So we take a photo, a retinal photo, and then read by a doctor, and if there's any problems, sent to the specialist upstairs where he lasers and does injections. So if you look here, it's a bit busy, but you can see we do have a lot of specialists. We have ophthalmology, so this figures is for July, December 2017, and our ophthalmologist does 1 day a month, and he sees between 20 and 40 patients in that day. And he brings his own optometrist to do screening. Cardiology, he does a half a day a month, and he sees quite a few patients too. Paediatrician, a liver doctor. We found that our patients weren't turning up to hospital-based Hep C treatment. In fact, we started interferon in a primary healthcare setting, probably one of the first Indigenous settings that were treating Hep C with interferon. But now we've got the new generation medication, so he still comes out and treats there. We have an endocrinologist, and sometimes he brings a registrar.